Now to another story brought to us by a viewer. We've all heard about the dangers of opioids as our country and province deal with a growing crisis. But there are many people who turn to these painkillers to manage their pain and for medical purposes, including one Toronto woman who says she'd like to part ways with the pills in favor of medical marijuana. However, she's been told it could cost her a pretty penny.
Tylenol 3, codeine, Percocet, Dilaudid, Tramadol, Butrans, and morphine.
Those are just some of the pain pills Natalie Morin has been prescribed in the last 17 years to manage her pain. Many of them opioids, the same drugs that are said to have led to increased addictions and overdose deaths here in Canada, leading to a national crisis.
I don't want to struggle with an addiction. And that's always been my greatest fear. And when I finally took the step to go on morphine, I felt like a failure. My son has to come in and help me out of bed. He's 10. Hydrocodone.
The 35-year-old says the drugs haven't been able to manage the pain she suffered from 2 car accidents in 2001 and 2. Today, she lives with herniated discs, nerve damage, torn ligaments, and whiplash. Knowing she wanted to taper off these pills, her doctor prescribed her medical marijuana, but she has to pay out of pocket. Her monthly cost for her pot prescription is $200. Unfathomable for the mom of 2 who says she hasn't worked for over a year due to her pain.
If doctors are being this thorough and they're this confident that this is a good treatment for people, why is it so inaccessible?
It's still not used so broadly because not so many patients are comfortable and also not so many healthcare providers are trained or comfortable doing it.
The medical head of addiction services at CAMH says prescribing medical cannabis is uncommon because there still is a lack of data and studies done on medical benefits of the drug. Health Canada tells CityNews the drug isn't covered since it hasn't been authorized as a therapeutic product in the country yet and provincially.
There are no such plans currently with regards to medicinal marijuana to look to adding it to the formulary.
However, Dr. Fall says there is more evidence that cannabis can be helpful for pain control, and there have been successful cases of patients transitioning from opioids to medical pot.
And we know for sure that the risk of overdose death is almost non-existent with cannabis, where it's huge with opioids.
Meanwhile, Morin says she's getting by through a compassionate discount from her local pharmacy.
If doctors are prescribing this, then it is medication, and medication should be covered.
Now, Health Canada tells us approximately 12 universities across the country are currently in different phases of conducting research on medical cannabis that could be used by health professionals. Coming up at 6:30, I'll introduce you to a young man who was able to get his prescription covered by his university. I'll tell you what he's doing to advocate for patients like Natalie.